Well, welcome everybody. I'm delighted. We've had for a Friday afternoon. It's starting to get cold but beautiful outside. We have a pretty good turnout here. And quite appropriately for Matt Myers. We were supposed to have Matt and his colleague Danny McGoldrick here, but he's had a personal family issues that come up and couldn't join us. So by way of background, Matt is a lawyer by training, but we forgive him. But we have about 25 lawyers on our faculty.
There are good lawyers.
Okay, there are good lawyers, that's right. And he was, amongst many other things, but the thing that we know him for was one of the founders of the Campaign for Tobacco-Free Kids, a very important group in pushing tobacco legislation and policy for its control. That was almost a quarter of a century ago, and for roughly 20 years he has been the president and leader of this organization. He also is the lead partner at Campaign for Tobacco-Free Kids, the lead partner for what is the largest and longest standing Bloomberg Philanthropies public health program, which has to do initially with tobacco control in low and middle income countries, and that has kept Matt and his colleagues on lots of airplanes all the time. And more recently, I've had the privilege of getting to know Matt over the years as I would attend various meetings at Bloomberg Philanthropies of their various groups, and Matt is a frequent attendee and presenter at those activities. And at the last one, I said, so Matt, what are you doing about e-cigarettes? And he said, we're doing a lot about e-cigarettes. I said, well, why don't you come down and tell us about it? Because for me, having gone into public health after tobacco was recognized as a huge public health problem, we're all in it since the onset of e-cigarettes. We are watching in real time the development of an enormous public health problem where millions, if not ultimately like tobacco, 1 billion young people are going to be addicted to nicotine. Forget what it is that they smoke and what that does to them, as we've seen this recent outbreak of a large number of deaths related to the use of JUUL and related. I have had some comfort from the fact that JUUL has just announced they're laying off 500 of their employees, and the people who the tobacco company that just invested in JUUL has just written down that investment by $4 billion. So there is some movement, but that's because of what has been an acute, sudden enterprise, and not because, at least in my understanding, because of a general concern. So we're delighted, Matt, for you to be here today. Teach us about advocacy and teach us how you go about doing this and what you plan to do in the future.
Thank you. It is actually a genuine pleasure to be here, and particularly with a combination of Dean Summers, who is, for many of us, one of the great figures in public health at any time in the history, but also with you've had a series of deans who have really I said, you know, very truthfully. There are a lot of schools where you go to and you talk about advocacy and they look at you cross-eyed as if you're some sort of alien being and you have really nothing to do with what you have to do. And so what I hope to do today is actually do a little bit of a combination of, I want to talk about the role of advocacy, but I want to use first tobacco and then e-cigarettes as examples with regard to it. And they're good for different reasons. I hope with tobacco to talk a little bit about, it is a clear-cut demonstration of what public health advocacy combined with working with science can accomplish. And e-cigarettes present a classic challenge, just as Dean Summers said, because we've all walked into it and they appeared just at a time where we thought we were making truly dramatic progress and raised all sorts of questions with a massive industry, and I sometimes joke, but with this sad commentary, that it represents the ethics of the tobacco industry combined with the speed of Silicon Valley to produce the worst possible result. And I think that's really true. But in talking about them, I really do also want to talk a little bit about the whole role of advocacy for people who care about the issues in public health, because in a very real way, in the 21st century, the diseases that we are going to be addressing increasingly require a kind of response that combines the best of broad public health advocacy with regard to those issues. So let me do first a quick, why are we relevant to it? The Campaign for Tobacco-Free Kids, and how do we fit in it? Because we were really created as part of a recognition of all of these issues. So the campaign was created in 1996, largely because people became really frustrated at the lack of progress on tobacco control. It's shocking to think, but in 1996, smoking rates among kids were actually going up. They had stopped falling among adults. Congress had not passed a meaningful piece of legislation in over a decade. And there was really very little going on. And if you read the newspaper, people still did read newspapers then, what you'd find is most often it was the tobacco industry side of the argument that was being created. So we were very much created with the concept of how do you take all the science we've had and actually translate it into changing both social norms and public policy and how public policy is made. 3 years after we were created, we became engaged in working with WHO and NGOs around the globe in negotiating a global tobacco treaty, the Framework Convention on Tobacco Control. Spent 4 years intensely doing that. It produced two things of real note. One is the world's first global public health treaty, which has had a dramatic effect, but only because of how public advocacy has been added to it. And second, the first real global network coalition of NGOs working on these issues, working together on these issues, bringing together the benefits, the Framework Convention on Tobacco Control. I personally believe that what happened in 2006 is a reason the Framework Convention has had the impact that it has, and that is when Mike Bloomberg stepped in and created the Bloomberg Initiative to reduce tobacco use in low and middle income countries, in which we and you are both significant partners with it, because what it did was seek to bring together the best of public health advocacy with the science and the clear-cut mandate that the Framework Convention. Many, many treaties sit on the shelf around the globe and have very little effect. Mike Bloomberg asked the question, how do we make sure the Framework Convention isn't one of those? And then the other part of the arm, and the reason it's too bad that Danny's not here today, because he runs it, is 5 years ago. We created within the campaign a center for global health advocacy in order to try to provide the advocacy skills and knowledge that are developed in tobacco and see if they could be applied to other public health issues. And for the campaign, it had a dual advantage. It meant that there were people in our organization who constantly asked, how do you do advocacy better? Which was a wonderful thing. And B, it allowed us to bring the skills and knowledge of different countries and public health advocacy to other issues. So it's the kind of synergy that actually really makes a difference. So what led to our creation? It's relevant to this discussion because at its core, it's a recognition that for the public health problems of the 21st century, we have to have the science. But having the science and publishing it in what I call the journal that only PhDs read doesn't move the ball. In a utopian world, you'd produce the science, everything would just follow. That's what they thought was going to happen in tobacco in the 1960s and in so many others, and it doesn't happen. You have to ask the question, why? Well, anybody who engages in public health that requires public policy changes realize that you face three core issues. One is, while we may know the science, decision makers don't. And you should never assume they do. They have a lot of things on their plate. They don't spend a lot of time thinking about these issues. They may know them superficially, but you should never assume they know them. Two, on even the most basic issues, inertia is one of the hardest things to overcome. And that is particularly true with public health problems unless you have a crisis literally banging in. And on many of the issues on which we work, it's slow motion death. And that doesn't arise to that level. So how do you overcome that inertia? And then third, unlike malaria, because mosquitoes don't in fact pay a lot of lobbyists and PR firms, the diseases of the 21st century almost uniformly have somebody who is making a profit and who is following the tobacco industry playbook, which means creating doubt about the science, political opposition, and understanding the political system to prevent reasonable change is something that overcome. And in many respects, our view of all of these things is, unless we tackle all three of those, change won't happen. And it certainly won't happen at the pace. So how do you do that? You know this better than I do. And that is, our approach to everything we do requires a combination of bringing together the best science and examining how to communicate that effectively and not just to other scientists. Understanding that unless you have direct advocacy, direct interaction with decision makers, you won't succeed. Understanding that because there is opposition and because you have to overcome inertia, you have to create political energy. You have to demonstrate it because that's what politicians respond to. And then unfortunately, this is one that shouldn't exist, but legal assistance. Legal assistance to sue government that doesn't do this job and to defend government when it does its job and it gets sued by the industry. So what does that mean? Well, if you think about those issues, the very first thing is we have to recognize that unless we take the science and communicate it effectively, most people, certainly most politicians, won't realize there's a problem. They won't understand the urgency of the problem. If they understand the numbers, the statistics, they won't feel motivated unless we create that sense of urgency for them. And they won't understand that there's something credible that they can do. That's our job, is to make sure we take that science, we present it effectively for the different audiences. And anybody who's ever studied it, you will see that, in fact, how to talk about problems requires you to understand who your audience is. The general public will respond to different things than the news media, and politicians will respond to it in that way. Two, you have to create a sense of urgency. You simply won't get anything done unless you create a sense of urgency. And sometimes, in this, only a lawyer could say this, people are dying all around you and it will create it, but most often that doesn't happen in that way. Think about some of the recent stuff you've seen even about Ebola and epidemics and how little governments are doing in response to that. Think about that, which means it's our job, if we want governments to respond, to figure out what will get under the skin of the politician, what will motivate them to act, what will both convince them that they want to desperately act and convince them that it actually is harmful to them if they don't act that way. Four, particularly because so many of the issues on which we work have somebody who benefits from it, we need to understand that the science of framing the issues, it's a combination of communications and real understanding of the public, is absolutely essential. For decades, we didn't get progress on tobacco because the tobacco industry understood it long before we did. Tobacco was about freedom of choice, government intrusion, adult decision-making. It wasn't until we reframed tobacco to be about corporate abuse, abuse of children, addiction, etc. There is a science to that. And it's very true that he who frames the debate is very often the one who wins the argument. Mobilization for action. It's not just in democracies where government officials respond to the public that they care about. I don't care whether you're an authoritarian government like Russia or in a different way, China or India. Those officials understand their power depends on a level of acceptance by certain segments and critical segments of the public. unless you demonstrate to them that those people care about what you want to have happen and their failure to act, you will not see action. It's our job to create, generate, and make visible that support. Otherwise, you won't get there. A lot of scientists think it dirties their hands to go into a legislator and say, this is what I want. Well, our message is if you don't do it, don't expect them to. You have got to be comfortable communicating that. It doesn't destroy your objectivity or your scientific credibility. It is the only way you can be sure that decision makers will understand the science and equally will understand the science of what works. And that is so incredibly important, which is the next issue on it, which is somebody, you need to get past the, oh, woe is me, we've got a big problem, to, oh, woe is me, we've got a big problem. And if you do item 1, 2, and 3, you will make a major difference. Or if you fail to do items 1, 2, and 3, you will be known for not making a major difference, which means we have to look at the science of what works, be able to quantify it, measure it, demonstrate it, and demonstrate to politicians that if you do what we ask, you will be able to go back to your constituents, and hopefully if you actually have a conscience, you're conscious, and say, this is the difference that we all made with regard to it. And then the last thing that I think any advocate needs to understand with regard to these issues is if it was easy, we wouldn't need to be doing it. Therefore, it requires persistence. It requires a willingness to get up and think about it when they don't do what you want the first time, or the second time, or the third time, or the fourth time. And that's particularly important here because industries that profit from creating disease never go away. We can't have a shorter attention span than they do. So let's use tobacco as a quick example. And then I'm going to talk about e-cigarettes because that's what everybody wants to talk about, unfortunately. You know, when we were created in 1996, adult smoking rates in the United States were over 25%. High school youth smoking rates were over 36%. That's stunning because 1996, think about it, that's 30 years after the report of the Surgeon General with regard to those issues. Look what's happened today in the last 20 years. Adult smoking rates are down to the lowest point since measured from almost close to World War I figures with regard to that. Youth smoking rates fallen even further. Nationwide, the latest data shows we're right around 6%, 36 to 6. I mean, just think about that for a second. And in some locations, there are 4 states that are under 4%. That would have been unimaginable. Now, we didn't treat our way out of that disease. What we did was we adopted policies that impact literally millions of people. We raised taxes. We provided protection against secondhand smoke that helped also change the social norm. We engaged in mass media campaigns that weren't just telling you what to do, but used the best science about understanding what motivates young people with regard to those issues. That's new. I remember having a debate with a senior person around 1990 who said, there's nothing you can ever do about kids. They simply won't change their behavior. You know, and I think it so underestimates kids across the globe. If we adults do smart things and use the best science and enable them to do it, they become our major warriors on this one with regard to it. So it is one of the great public health examples of success. And it's not just in the United States. That's what's really exciting about this data. Most of the data about what works in tobacco control was developed in wealthy nations. Since Mike Bloomberg and Bill Gates began to fund organizations, including you and us, to work in low and middle income countries, we can demonstrate that the right advocacy in those countries as well, in different political systems, different cultures, different stages of the epidemic, using science-based solutions, science-based communications tools, can have the same impact. The very first impact is that, in fact, we can show you can get these policies adopted. The changes are really dramatic. But more important, from our point of view, is what we have learned conclusively in multiple different cultures, multiple different stages of the epidemic, multiple different political systems, that we can reduce tobacco use just as rapidly, in fact, even more rapidly. You know, from Bangladesh and India, where you walk in and you think it's just a cacophony of noise, no one's paying any attention whatsoever, you know, to an autocratic country like Russia, with regard to those issues. And I could give you other examples around the globe. Brazil, which off and on is a thriving democracy. Not at the moment, but with regard. But it's the important lesson. You know, these things are universal in terms of the change. And you look at the overall nature of these things. This chart's really pretty dramatic. What it shows you is that when the Framework Convention was adopted, despite all of the scientific evidence that had been out there for decades, across the globe, cigarette sales were skyrocketing still. All that science wasn't changing the norm. 2 years after Bloomberg began funding, 3 years after the ratification of the Framework Convention, where people were working in the countries where the problem was the worst, we suddenly saw a flattening. 3 years later, for the first time, we saw a dramatic change. Not as dramatic as some of us would like. There's a massive amount more to be done. But if you want an example of the impact of public health advocacy, and if you want a real measurement, you can begin to see what would have happened if that didn't happen. The curve and the change. It's not that it was more science, it was that we brought all of the tools that we know how to do, combining science, research, and examination of solutions, effective communications, how to mobilize the community in different political systems to bring about change with it. It is truly an affirmation of everything you all learn here and the importance of bringing public health advocacy broadly defined, scientifically based, to these jobs. And then comes the vaping epidemic. So, you know, I sit on a committee with Joanna, actually, that provides evaluations by the state of California. In California, high school cigarette smoking rates are 2%. 2%. And in comes vaping. In comes e-cigarettes. And what's the change? And so, stepping back for a quick second, the response can't be an emotional one. It has to be a scientific one. We have to think about this issue in a very clear, cool way. Proponents of this say these products are different. These products are actually part of the solution. As a matter of fact, they're the key to the solution. That they will be used by adults to switch off of cigarettes, the most lethal product ever created in mankind. And B, that they are more effective than any other tools we have out there to do that. Those are the assertions. And we in the public health community have tied ourselves up in knots trying to figure out what the right answers are. So what's our job? Our very first job is to understand, is there science to support those solutions, those statements? Is that what will happen under these circumstances? But we have a separate question, too, that applies to so many of the issues of the 21st century, which is, what's the role of government here? Because e-cigarette makers say, government just gets in the way of innovation. When we think about, you know, normal food and drug regulation, the theory is there actually needs to be somebody overseeing this to make sure that the scientific statements are, A, that the science is done, that the scientific statements are accurate, B, that they're marketed to the people who they say, and then C, D, somebody's monitoring it. Well, we unfortunately have a real-life example of what happens when government doesn't do that in this case. There's another core premise that we need to start out with, which is e-cigarettes are not inherently good or inherently evil. They can't be that simply categorized. with regard to it. And if we want to provide honest, factual, science-based answers, we've got to be exploring, are there circumstances where they can be good? Under what circumstances? Are there circumstances where they can be harmful? Under what circumstances? If we're going to provide solutions that actually promote public health over the long term, we need to know the answers to those questions as well. We need to know something else. This is so true across a range of issues. Harm reduction is not a new issue. It wasn't invented with the e-cigarette coming on. The tobacco industry's very first reaction to the first Surgeon General's report in 1964 was harm reduction. They took out advertisements saying they cared as much as the scientists did. They were going to produce new products that they evaluated that would reduce the harm of tobacco use. The initial ones were filters, then it was low tar, and then it's one thing after another thing after another thing. So one of the things that we need to understand is this is not a new strategy and a new tactic. And if you think about it, it applies to a lot of the food folks in terms of obesity and diet and nutrition and every other field. Our job is to make sure that the high road of harm reduction isn't something that the other side captures. But it's equally to make sure that if there is a pathway to harm reduction, we're open and figuring out under what circumstances that would happen. So what's the reality? You have all of these claims out there. The reality in the United States is, in the absence of any meaningful government regulation of any kind whatsoever, despite the fact that the U.S. Food and Drug Administration has all the authority in the world to regulate, what we have seen is an epidemic of e-cigarette use. What we have seen is that the evidence that they actually are helpful to smokers is scant and often done on products that aren't even being marketed anymore. And that if you actually are concerned about smokers, you should be as outraged as you are if you're concerned about kids. Because a huge percentage of adults have tried these products to quit. And we have provided them no good scientific information to know which, if any, of these products are actually effective or under what circumstances to do that. So what does the data show? Why is that happening? There's a lot of ways to express it, and before I go into the data, I think the JUUL people probably said it the best. They didn't mean to say it publicly the best. This was a private document. We don't think a lot about addiction here because we're not trying to design a cessation product at all. Anything about health is not on our mind, is what one of their internal documents says. They were creating the Marlboro for the 21st century. They wanted a cool, slick product that they could use to addict as many people as humanly possible. And boy, were they good at it. I'm going to show you a couple slides to give you an example to look at the issue of if you're concerned about kids and if you're concerned about adults, what does the data show you? Well, here's the growth in the e-cigarette market there. This is the JUUL market. JUUL was introduced in 2015, one of the most brilliantly evil products you'll ever see, from my perspective. And what do you see about youth use with regard to that? It's almost a straight line. JUUL comes in, and we see this geometric rise among youth use. It is virtually identical with regard to that. But, some people will say, well, it's kids. It's helping kids avoid cigarettes. So maybe it's not a terrible trade-off. But you actually look at the data, and the data shows that with the introduction of JUUL, our progress in reducing cigarette use among kids actually stalled out. For 3 consecutive years during the largest increases, we saw no progress among kids for the first time in a decade. Now, it came back this last year, and we're going to have to look and see. But there's no way to argue that JUUL is a result of the sudden decline that sits out there. What does it mean? It means that we have 5 million kids today in the United States using e-cigarettes. That by and large, as I will show you, those are not the kids who would have smoked. It's an increase in the number of kids. And we hear many apologists for the industry just saying, gee, they're just experimenting. Well, actually, the figure that 11.7% of the kids who use it are using it almost daily Put it in context. Among kids who experiment with cigarettes, that figure is about 3-point-something%. So in terms of the number of kids who are using it in a way that demonstrates addiction, the percentage is 3 to 4 times as high for e-cigarettes. And if we think through the long-term implications of that, it's really pretty frightening when you get down to it. And what it does mean is that today in the United States, we have more kids using nicotine-based products than at any time since 2001. And that number is continuing to go up. And we have a higher percentage of those kids who are doing it in a manner that demonstrates a deep and serious addiction. But what about adults? Hasn't this saved the world? Hasn't this led to dramatic decreases in adult use? So let me give you the same chart, but this is adult use. And the same chart will show you that the geometric rise in e-cigarette sales is accompanied by no increase whatsoever in the percentage of adults using these products. If you just take the two different charts next to each other, you sort of know all that you really need to know about where these products have had their impact. And unfortunately, it is not in helping adults quit smoking. And if you look at adult trends, it reaffirms that. We were making dramatic progress in reducing cigarette use among adults. JUUL comes in 2015, and you look at the next 3 years, that line down just flattened out. Now it's going down slightly again this year. But JUUL has not been associated with an increase, it's just the opposite. And the argument goes, okay, this is just switching kids who would smoke to e-cigarettes. Really good research has come out on this issue. I mean, this is another good example of the role of research. And the research shows that by and large, in very large numbers, the kids who are using these products are the kids who are at the lowest risk of smoking. They're the kids who never would have picked up a cigarette. They're better off economically, they're doing better in school, they're athletes, they're dancers. And multiple studies have shown, no, this isn't picking off those kids, it's creating a whole new generation. And I have to admit, Wall Street thinks that's great, because that's a new market. This is, Wells Fargo. JUUL is introducing new users into the category. This is because I want to promote the purchasing of it. And equally, as it relates to adults, they're enthused because, in fact, it shows that most adults who use these products continue to smoke. So it's the best of both worlds. They're using Marlboro and JUUL simultaneously. For Wall Street, that's great. For public health, not so much. We also get a lot of the questions that goes on to this about, well, even if that's true, e-cigarettes are so much less dangerous than cigarettes are. So, the net harm, how great is it? Well, first of all, we have to realize we're dealing with a new product. We don't really know what the long-term harm is. How long did it take us to figure out the harms of cigarettes? 2, with the introduction of JUUL, we are marketing products that deliver nicotine at higher levels, more efficiently, without any of the traditional barriers than we have ever done before with regard to that. So if you just were to look at the nicotine, which, historically we've all said doesn't cause cancer, what you are seeing here is a large group of kids who are becoming deeply and seriously addicted. That has implications all by itself, because we know that nicotine for an adolescent brain is harmful to development. B, any individual who becomes subject to an addiction as an adolescent is more likely to suffer from lifelong problems of addiction. And that means you're going to move on to other substances with regard to the issue. So even if you didn't have other related diseases, you have a problem. But slowly evidence is emerging of other related diseases. Does it really matter if it's as dangerous as a cigarette? What is absolutely clear is it's dangerous, and that it's going to take years for us to know how dangerous it is, and that in very frequent numbers, it's not cigarette smokers who are using it. So you take a healthy 14-year-old kid and you add an e-cigarette. It doesn't really matter whether it's more or less dangerous than a cigarette with regard to that. And that we are getting increasingly solid data that shows non-smoking kids who use e-cigarettes are now clearly much more likely to go on to become cigarette smokers. One study shows that it's roughly to 3 to 4 times as likely to do with regard to that one. National Academy of Sciences looked at it. It agreed. The data since that time has gotten even stronger on the issue. So how did it happen? This is my slide, by the way. JUUL actually didn't create this document with it. So I don't give them credit, but I give them credit for doing it. They really did it thoughtfully and scientifically. And we now have evidence that they went back and looked at the old tobacco industry documents, which are now online, in order to examine it. So what did you do? Lure kids with sweet flavors. Provide massive doses of nicotine. Make it cool, because cigarette smoking has become uncool to do it. In this case, team up with big tobacco so that you have all the political muscle you need to ensure that the government doesn't act. And what does that look like? Well, first of all, what does it look like? The vast majority, 97% of current e-cigarette users started with a flavored product. 70% of them say they use it because of the flavor. 2 years ago, JUUL, with a great announcement, said, we are good guys. We are going to move all but the mint and menthol flavors off the retail shelf so you can only get them online. And within 12 months, kids gravitated to mint and menthol in equal numbers that had done before. And we now know from JUUL's internal documents, they knew that was going to happen from day one with regard to it, if you think about those issues. So that what you see is JUUL makes their big announcement in the fall of 2017 that they're taking these products off because they are socially responsible. And what happens by 2019, use of mint and menthol is up there equal with the other kid-friendly flavors. Massive dose of nicotine. I don't know if any of you played with a JUUL. Have you ever seen it? The little pod there has the same level of nicotine as a full pack, 20-pack of cigarettes. Now, what's brilliant about that is not only their ability to provide that much punch in that little space, it's with JUUL, technologically, they eliminated the barriers that makes it hard to intake too much nicotine. Chemically altered it so that the smoke no longer is harsh, so it's not tough to get into your lungs. With the sweet flavors, that basically, you ask kids, and they can't, how could something that's mango or mint or creme brulee be harmful to you? Don't believe it is, with regard to it. They eliminated your ability to smell it on someone's breath. So if you're a young person and you don't want your teacher, your parents, or even your friends to know it, you can inhale all the JUUL you want, and I can come up and smell your breath, and I'm not going to be able to smell it on your clothes or on your breath whatsoever. And then they did something else that's really very smart, which is one of the geniuses of JUUL is that it delivers nicotine to the brain as rapidly as a cigarette. What they don't talk about is that the level of nicotine drops as rapidly as a cigarette, so that it means that fairly soon after you've gotten your hit, you need another hit, and then you need another hit, and then you need another hit after that. Now that's good because that means you buy lots of pods. It's pretty bad if you're worried about it because it is a critical way to both initiate, foster, and maintain addiction, not to wean somebody from becoming addicted. And then how do you overcome the fact that cigarette smoking had become so uncool? You create the coolest high-tech product you could imagine. I mean, it is brilliant in terms of, you look at that, you associate none of the risks of smoking with a flash drive. None whatsoever, right? So not only do your parents not have a clue what's going on for 2 years, but you don't have any reason to associate any of the harms of cigarette smoking with this. And then you put all the cool stuff on it, and you have taken a population who decided that smoking is no longer cool and created a product that makes it as cool as anything they're doing and not associated with any of the harms. And then how do you market it? This is clearly aimed at 45-year-old adult smokers. The bottom picture is launch parties, TV ads, billboards with regard to that. Moving right along to the use of social media. It's one of the reasons why government adults didn't see this for a very long period of time with regard to it. Now, what did JUUL say about it? JUUL said, oh my God, we didn't have anything to do with it. We're horrified. Totally horrified that that's the case. Boy, did we not really mean to go after kids. Yep, that's a JUUL hashtag. And she was a paid influencer by JUUL. One of JUUL's competitors. Again, we're looking at these 40-year-old adult males who are there trying to get to quit. But fortunately, this is another area where science debunked it. A really good study done, published in Tobacco Control. It documented clearly JUUL's financial link to these activities, JUUL's studies of these activities, the magnitude of these activities, even looked at the themes and compared them with the themes of cigarette advertising for 30 years before. But the key to that study is how many politicians read Tobacco Control? This is one of those classic cases that unless we bring that to bear, that wonderful study will sit on the shelves and we'll all talk about it and nobody else will. One of the grand ironies and something that some says is really wrong with our system. I was the first person who showed the Commissioner of the Food and Drug Administration those ads. He had never seen them before. So we should never, when I go back to say we should never assume that people in the high places actually know what's going on. It's our job to do that. You can't underestimate the importance of doing those things if we're going to succeed in doing that. We have got to break that theme. We have got to make clear that people understand this stuff. And it's not just JUUL. Philip Morris / Altria has a heated tobacco product, and they're saying the same thing. It's all about adults. It's all about adults quitting. We are reducing the risk of disease. And I could give you 30 other ads, but again, this is the same adult 40-year-old smoker that they're looking to resist. I could show you the beer blasts, the concerts they're doing. And these companies are doing something else. One of the good things the tobacco control movement did was examine the programs the cigarette industry developed years ago when they said, we're going to prevent kids from smoking. And they created all of their youth prevention programs. Well, the one thing you could say about every cigarette company youth prevention program is it doesn't seem to have ever prevented a single youth from smoking. And in fact, kids who were exposed to those programs ended up being at higher risk because it meant that the cigarette company was no longer perceived as the absolute negative influence on them. So in fact, if there was any association, it was the wrong association. What did JUUL do? Well, JUUL developed its own program. What it did was stole the most ineffective components of a program developed by Stanford, eliminated the components of the program that actually do really work, put the Stanford name on it until Stanford realized it and objected, went actually into schools, including in Baltimore, with JUUL representatives. And the congressional testimony is that the school teachers left those people alone because they didn't want the kids, they wanted there to be an honest exchange, not realizing what was going on. And during that honest exchange, the JUUL representative said to them, much safer than smoking, if you're worried about this issue, you can try this. Don't worry about this, just don't smoke cigarettes with regard to it. Those are all things important to learn. Unless they get to be part of the public dialogue, they don't influence change. And on cessation, this is a harder thing to measure. There are studies all over the place with regard to this. But the bottom line to it is what we can say for sure is every credible organization that has looked at this, from the U.S. Preventive Health Services to the Food and Drug Administration to the Centers for Disease Control to the Surgeon General of the United States, has concluded there's inadequate evidence to conclude that e-cigarettes are an effective way to get people off of cigarettes, despite the claims. And even when you look at them on a population-based study. Now that doesn't mean that all the studies say that. But this is one of these classic examples where we talk about the role of government. It can't be up to an individual smoker to be told you have to figure out of the 40 studies that are out there, which one do you think is the one you should rely upon? And the other thing to realize that's particularly true in this field is that virtually every one of these studies was done using products that are either not on the market or no one is really using. So we've probably all read that there was a really interesting study, and pretty well done study, in the United Kingdom, where a small group of people went into a smoking cessation clinic. They were offered one form of an e-cigarette, an open tank system. They were given counseling. They were given a 3-month supply. And for those individuals, they found that they were more likely to quit than people who were just given straight nicotine replacement therapy. Well, the reality is, in the United States, you saw that lineup of it's not a JUUL product. It has no relationship to JUUL whatsoever in terms of nicotine delivery. It was done as part of a controlled study, with people who were part of a smoking cessation product. So there's an interesting lesson there, but it's not the lesson that's been communicated, and it's not the one that our government has helped do. So what's our job? Our job is to make sure that those facts become all the facts, honestly, accurately, but clearly and understandably are put forward in a variety of different forms. Our website, a lot of other websites, the Truth Initiative, the CDC to its credit, the Surgeon General to their credit, has done a really nice job of trying to document this stuff, trying to communicate this information. And this is a case where we have to communicate it to parents, teachers, as well as media and policymakers. We've got to frame the debate. Remember, I talked about framing the debate. If we don't do that, then nobody else will. People won't understand it. So for us, what our polling showed, what our research showed, is people responded to the notion that there were all these sweet flavors out there attracting kids. And we spent a lot of time talking to ourselves about how do we make sure people understand the importance of that issue? How do we associate that with what they think about with it? We issued a report called The Flavor Trap. We met with media all across the country. We met with political figures across the country. We used every opportunity we could to reinforce it. We've recently done paid advertising to lay it out there, to understand, in order to make sure that we were the ones who were talking about this in a way that would be useful, to frame what our concerns are, to get that message out really clearly and as effectively as possible, even though we obviously have a fraction of the money available as the tobacco guys do. And looked at every other opportunity to do that. Whether it's in the opinion pages of newspapers, blogs, and on social media, a great deal of work with regard to that. Communications to the administration. Increasingly, what we're doing is trying to put things actually on small ads on the social media and the news media feeds that are online for people to see. And again, the message has got to be really very, very simple there. Our message is protect kids, not big tobacco, fight flavored e-cigarettes. Not very scientific in terms of, we're not going into a lot of detail there, but we're trying to figure out how do we get people to think about this issue in a way that will motivate them to move, to take action, to understand it in an effective way with regard to those issues. Dealing directly with the solutions. Putting forth a series of solutions to talk about it and getting them out there. That image over there is the Truth Initiative had a session with the First Lady where they brought in a group of young people to talk about these issues with regard to those things going on. Constant talking to the media if there is something that can be done. Constant talking to the media so that people understand what the issues are in very simple fashion. That chart I showed you about the move to use mint and menthol flavored products is something we need to communicate, and it's stunning how few people understand it. And if we don't get that message out, it becomes increasingly important to do that. Now, the other piece that I said is important is you have to demonstrate that actually people care and that people are on your side of it. You know, it's not a message that a scientist would care about, but it's a message that a politician would care about. And that's who's going to make a lot of these decisions. You know, so in this case, what we wanted to show was that percentage of people who support eliminating flavored products is not only enormous, in a country that disagrees on almost everything, this is one where there is no disagreement. Conservative Republicans support these changes in the same numbers as liberal Democrats do. And the same is true geographically. It doesn't vary geographically with regard to that. And this becomes particularly important because the industry has funded some polling that defies scientific merit, but it says the opposite. So if we don't do this, the industry will control that debate. And so what does it mean? Then you've got to put forth very concrete solutions, and you've got to make them simple and articulate and clear. You know, for our purposes, it's multi-pronged. I'll start with the right side because it's the easiest. While everybody waits for Washington to act, one of the things we've been trying to communicate to city officials and state officials is there's lots of things you can do. But kids are using the flavored products. If you get rid of the flavored products, you are taking a very concrete step that will have an impact. Now, candor requires, until folks do that, we can say that because we believe it, we can say it because the scientific evidence demonstrates it, but we don't have, you know, studies yet where people... Oh. Sorry about that. I thought I turned that off. Even worse, it's a robocall. On that. So we, you know, we have succeeded in passing legislation in a number of cities so far that does that, and are setting up mechanisms to evaluate exactly what happens there. Now, we want to do that both to motivate others to act, but candidly, we want to do that because we want to make sure that we're spending our time doing things that actually work. So it is the same sort of thing. It is very important from a scientific point of view to make sure that if we're advocating something, that it will, in fact, make an enormous difference with regard to those things. And that's something that it's simple and people can understand and they can do. Let's get rid of mango and brulee and mint-flavored e-cigarettes. It's a compelling argument. Second, much of what's gone on is because the Food and Drug Administration, which has all the authority it needs, hasn't exercised that. If the Food and Drug Administration had been doing its job, over a year ago, no product would have been allowed to be sold without having undergone a health, safety, and efficacy review by the Food and Drug Administration. But first, the Obama administration put off for 5 years taking action, and then the Trump administration delayed it another 4 years. And as a net result of that, not a single e-cigarette has been evaluated for content, safety, impact, youth appeal by the Food and Drug Administration. Not one of that. And so when people suddenly start dying and we don't know the answer, well, the reason we don't know the answer is because no one has been looking. No one has been collecting the data so that we could know the answer. Why has it taken us since the summer and we're still just fishing? If, in fact, these products have been undergoing some review, if the people who made them were required to do some science before they experimented on 5 million kids, we might not be in this position. And the reality is, even though roughly 3/4 of them use both nicotine and THC, you know, somewhere between 10 and 20% of the people who suffered from lung disease report only using nicotine-based products. Is that accurate? Not accurate? I don't know the answer to that. But what's appalling is that none of us know the answer to that. I mean, that's the sort of thing where we ought to be marrying science with public policy. So we are spending a huge amount. We sued the Food and Drug Administration, on it, and as a result, we have a court order so that they will be required to begin reviewing these products next May, which is a couple of years earlier than they were going to do it, nowhere near as early as they should be doing it. Working on legislation in Congress to make FDA do those sorts of things and to evaluate the right kind of areas with regard to that. But equally important, continuing to work with the media, parent groups, teacher groups, both to get them active, but so that all the disinformation out there is overcome with regard to that issues as we do it. Which means that the combined direct advocacy has to be coordinated with communications that are consistent, that are repeated not just by us, but by many, many others with regard to it, and that we're beginning to create a grassroots movement, reaching out, mobilizing people. Unlike a lot of our other issues in tobacco control, this one is easier because parents across the entire country are freaked out. And I hate to say it, but I want to take advantage of that. I want every one of them. I don't want any legislator, I don't care at what level of government, I don't want any public health official to go into their community and not have a mom or dad saying, what are you doing about this? And that's our job, to make sure that they're given an opportunity, that they're empowered to do it, that they're given the information they need to do it, that we actually are suggesting that they do it moving on forwards. Dr. Scott Gottlieb, the former commissioner of FDA, who was the one who basically gave the industry a free pass, has finally come around and acknowledged now that he's no longer the commissioner of the Food and Drug Administration. He won't say he made a mistake, but he will say this product has got to be regulated in a way so that changing the public debate becomes really important with regard to that. We're beginning to get cities and states to move. And from our point of view, is what they need to be thinking of as long-term solutions. 6 governors have issued executive orders because they're freaked out by the lung disease. They need to be equally freaked out by the number of kids who are becoming addicted, and they need to be putting in place systems for doing that. So we're working with all 6 of those governors, to defend the legal action, but equally important to talk to them about legislation that they should be moving through their legislature to address this issue long-term with regard to the tools that they've got on those issues. The good news is that, in fact, all of these proposals are really very, very popular. For the first time in a long time, we're actually having some trouble holding some governors back and doing things that the science doesn't support, just because they're suddenly so anxious over it with regard to it. But it's a good marriage. And it's not just the United States that we're seeing this. And all of the data from this actually came from you all and from Joanna. But we are seeing the introduction of these products in every one of the low and middle income countries, as well as high income countries in which we're working. This is an area where country-specific knowledge becomes really very, very important with regard to that. Think for a second, I showed you a slide about roughly a 20% decline in overall tobacco use in India. India has roughly 27% of its population uses tobacco, but only 4% smoke traditional cigarettes. The rest of them use indigenous Indian tobacco products, for which e-cigarettes are no substitute whatsoever. No one should be under any illusion. JUUL and the other e-cigarette companies aren't coming into India because they're concerned about that 27%. Or frankly, the 4%, even though in India that's a large number, is not clearly the market. But there are several 100 million Indians who are in middle class, or his family has moved into the middle class in the last 15 years, between the ages of 15 and 30. And when you look at what happened in the United States, and magnify that by 4 or 5 times, that's the market in India of who will be using these products. Any discussion in India about harm reduction, which the industry says with a straight face, is just defied by all the data. So in a country like India there, the conversation wasn't, is there some sort of way you could fine-tune regulation? The Indian government lacks the capacity to do that. You let these products stream through this market. We're going to come back 5 years from now, and the numbers we're talking about of 5 million US will look totally tiny compared to that. So in India, what we said is, what makes sense for your government is ban the sale, importation, and manufacture of these products. If in 5 years you learn from elsewhere that there's a way to use these products that are effective, you can revisit that. But from a public health precautionary point of view, if you let the products in and you end up with 30 million users, you're stuck. You're never going to come back on that one. So you need to think about how you do that moving forward with regard to it. And we see the variations across the globe are enormous on this. So when we think about this one and we think about our advocacy on this one and think about how we adjust it, we need to realize we are dealing with a scope that is enormously broad and need to help devise strategies, solutions for talking about this appropriate for each and every one of those locations if we're going to succeed. It's not the same message, it's not the same verbiage, and it won't be the same impact. So it's our job to understand that and make sure that we have developed messages that are appropriate for each country, policy solutions that are appropriate for each country, and that they're communicated in ways that are both culturally sensitive and will resonate in each country. It's the same thing that we had to do on the traditional tobacco-related issue with regard to it. So, long way to say, with regard to e-cigarettes. We have answered, unfortunately, the question of what happens in the absence of rigorous government regulation. And all the answers are not pretty. The answers are youth are at risk, adults who are looking for proven solutions aren't provided them. The kind of innovation that you would hope would take place is the wrong kind of innovation that takes place in the absence of manufacturers knowing that they're going to have to present evidence to a government agency showing that the product is safe and effective. And instead, all of the innovations have simply expanded the marketplace, and virtually none of the science has provided the kind of answers that we want. There is a reason we have a Food and Drug Administration. Not only does it protect people from misleading claims, but it compels responsible manufacturers to do good science. And we don't often think about that. But this is a classic case of if you're not pressured, if you're going to be able to sell your product without having to do science, you're not going to do it. And what that means is that even if you start out as a responsible manufacturer, you're going to be pulled to the lowest common denominator, because that's where the biggest profits are to be made with regard to that. It is a real lesson and learned about the role of government and the importance of government as we move forward. But for all of us, it's an equal lesson as we need to tell that story well, because it applies to a lot of different products and a lot of different things that we do as we go about here. There's another thing that I think is important here too, and this goes back to early framing of the message. The public health community has tortured itself in terms of those in our community who in good faith are saying, with all the people who die from cigarette smoking, if somebody has come up with something that could increase the pace at which we reduce that death, we need to take a risk to do it. Versus those who say, I don't disagree with that, but what's happening out there is very, very different. And therefore we have to adapt policies for what the reality is, not what the hope is. But it makes it really important that we all think about how we frame those discussions in moving ourselves forward on these kinds of issues with regard to this. The reality is, in tobacco control, despite the hysteria and the rhetoric, this is by and large not a debate about harm reduction. This is by and large a debate about what controls do we need there, how do we make sure the system works in such a way to produce whatever the positive benefit is. At the two extremes of the debate, there are some people who think the only thing you can do is you shouldn't give people NRT, you shouldn't give any nicotine, if they can't go cold turkey. That is a minuscule number of people on there. And at the other end of the debate, there are some people who believe we ought to be making nicotine available to anybody who wants to use it without regard to that. Push those two aside. The bulk of the people are out there saying, how do we reduce the number of people who die from tobacco use? And where does this fit within it? And what kind of controls do we need on this? And should we count on an industry that has figured out all the rhetoric but doesn't behave in that way? And it's interesting, if you were actually to do a study and say, where do different people lie? It's by and large academics and people who do cessation work who keep saying, well, maybe the industry's not behaving well, but we should give them more freedom. And people who involved in public policy at any level, whether you come from academia or elsewhere, who are saying, wait a second, what I'm seeing out in the field here says to me, these are not people to be trusted with regard to that. And it's our job, ultimately as advocates, just as it is anybody who works in public health, is to ask ourselves as honestly, objectively, and unemotionally, what does the science say? What does the data say? And how do we come up with mechanisms to drive the best possible result? And that's not an always easy thing to do, but I'm proud of our organization because I think we work really hard at doing it. And we get equally criticized by both sides, so sometimes we're doing it right on that score with regard to it. But it is very important. And these issues are going to become more important because of all the public health issues, the non-communicable diseases we're facing in the 21st century. Across the board, all of these same issues are going to arise in one form or another. And our ability to frame the discussion, discuss them objectively, honestly, and figure out how we make the systems work and public attitudes work is going to define what happens, not just on tobacco, but it's on diet, nutrition, climate. You run the whole gamut on those kinds of issues. Those who profit from this learned a long time ago, there's a lot of money in manipulating the political system. Those in public health and science thought, gee, if we just produce the data, we're home free. We need to learn to figure out, to make sure we're all playing that game in a way that is honest, objective, accurate, but that is as effective as necessary to produce the best possible result. Thank you.
We have a couple of minutes for comments or questions from the floor.
What kind of conversation is taking place among the AGs, the attorneys general, or do we not know enough yet about the damages for those conversations to be had?
Well, a number, I actually met with a bunch of them about a month ago. A lot of them are concerned. We're trying to figure out what they can do. The issues the causes of the problem are pretty similar to the behavior of the tobacco companies. The harms are less well defined for them. Attorney General of North Carolina is the one Attorney General who's filed suit. Massachusetts, New York, and 2 or 3 others have ongoing investigations that are looking at these issues and trying to figure out what, if anything, they can do.
Right. So, Matt, I was surprised by that data from countries around the world. Mm-hmm. I spent 3 months in the UK this year, and vaping is everywhere there. The young people on the streets, outside of every bar, outside of office buildings. So I'm wondering whether for young adults it's greater than that. Do you have any sense?
Yeah, so the UK is the one country where they have taken a different approach in their minds to these issues. They, with their health system, they believe they can control it. They believe that e-cigarettes added to the arsenal of other things out there can be helpful. The law in the UK is such that e-cigarettes there can only have a fraction of the nicotine that they're allowed to have in the United States. JUUL has 59 milligrams of nicotine per milliliter. In the UK, JUUL has 17 milligrams of nicotine per milliliter. They have absolute rules on advertising that our First Amendment, as our courts have interpreted it, have prevented us from doing so with regard to that. And they don't permit any health claims of any kind whatsoever. They say their data is quite different, that they have much lower levels of addiction among kids. I was actually looking at their data about a month ago and having an exchange with one of the advocates who at least will exchange equal data. You know, it's interesting, as e-cigarette use there has risen, use of NRT has fallen almost equally with regard to it. So it isn't yet clear to me that in fact they're seeing better results with it. And if they are, they're doing it with a product that's very different than the one being sold here. And JUUL has only been in the market there, even at the lower levels, for a shorter period of time. So it's not yet clear. But it is a classic example that says, when we look at the impact of these products, I think we have to look at them holistically. The product, how it's marketed, the rules of the government about the limit to whom it's marketed with regard to these issues, where they are within the framework of the epidemic. Don't forget, the UK also, you know, only allows plain packaging of any tobacco product. They have, you know, really good graphic warning labels that we don't have yet, and the like. So I think we're at one of those interesting points where we're seeing is the difference between the UK experience and the American experience going to hold, and B, what lessons can we learn if it does hold about why that is the case. Interestingly, in the UK, JUUL is lobbying very heavily to have the nicotine limits taken off with regard to that. So I'm sort of hopeful that, you know, the UK, which says they're having a different experience than the rest of the world, doesn't change the rules with regard to that. And the youth use in the UK is something that's in dispute. Just, you know, their data shows lower levels and lower levels of regular use. But the more I've talked to people, you know, the daily experience seems to be saying, I'm not quite sure that the reporting is as accurate. The other interesting thing is in the UK, this is more boring than you want probably. You know, if you separate e-cigarettes into two broad categories, what are called open tank systems, the one you pour e-liquid into, and the closed systems, things like JUUL that come in either a pod or cartridge. In the US, 3/4 of sales are in these closed systems. In the UK, 3/4 of the sales are in the open systems. I think there's pretty interesting reason to believe that if any of the products actually are helpful in getting people to smoke, it's probably the open systems in some form with it. And their market hasn't yet shifted over there. Whether it will or not it's too early to know the answer to that question. But it's a reason we need to look really closely at what's happening in multiples of these countries. So, you know, if you were to go to look at Poland and in the Ukraine, what's going on in there is really quite troubling.
I think time is up. This is terrific, Matt. We got to get you back here soon.
Thanks, sir.